little bit of a blurb about me. So yes, I'm from England, you possibly got that. Been a vet nurse for a very long time, and I've done a few things with my career. So some of my highlights, I've travelled quite a bit, so worked in Namibia and South Africa, and also Australia with quite a number of different species and things. That's pretty awesome. Lived here for 15 years now, and worked in a few first opinion practices, done a bit of hydrotherapy, also got my teaching qualification as well, and used to teach anyone at the Vet Nurse Plus student. Hi guys. And so now I do dermatology, which lots of people often go, why do you do dermatology? You obviously kind of like dermatology because you're here? Or you just here because it was free food and a free goodie bag? Don't nod. No. So, why do I like dermatology? Well, I really like kind of doing one thing and being quite good at it. So, after doing 20 odd years of veterinary nursing, I've seen quite a bit. Now I concentrate on one topic. And I just kind of enjoy getting to the bottom of these chronic skin cases. So, does anyone have a pet with a skin problem themselves? You do? Ellie? Yeah? Okay. So, it's not fun. How many of you have got clients with skin problems that come into clinic? You all have, that's why you're here, right? It's massive. I'll get this right.
The puppy, they said. It'll be fun, they said.
It's not fun. I have this wild puppy called Dottie, quite happy named. And Dottie, the reason she's up here is because, Dottie has skin problems. Of course! Of course I was going to get a dog with skin problems, wasn't I? They're going to be, A, she's white, sorry, I'm all the white dog, it's pretty. And B, I'm a skin vet nurse, so yeah, it was going to happen. But now I can kind of really relate to my clients, it's kind of made me a little bit more passionate again. Now I have to treat my own pet. So there are some pretty grot bag pictures in here. Good job you've all eaten, chew quicker. They're not for the faint-hearted, some of them. And we're going to just talk a bit about skin disease in general. We're going to do a bit about low stress handling, fear-free handling, and things like that, which I might plot that out into a bit as well, because I'm really passionate about it. It's really important when we're dealing with these skin patients. And then taking cytology samples, and then how to look at them under the microscope and things like that. So, just as a raise of hands, whose vets do cytology in clinic currently? Yeah, who of you are taking the samples themselves? No? You do, Jenna? Cool. Yeah. Do anyone look at them under the microscope? A little bit? That's cool. Gary's probably, are you some vet at your clinic? And how many nurses do you have? Couple? Would it be beneficial for your nurses to know how to take proper samples and look at them? Yeah. So this is kind of the idea behind it.
She's doing it for the other vets.
This is the okay, cool. So this is kind of what I want you to get from this, is like you can help your clinic, but there's also a lot more reasons why it's very important to be so skin disease is massive. We know, we've said that. We're fully booked till October. Help us. We need more dermatologists in Auckland. But allergies tend to be the main cause of these skin patients. There's heaps of different presentations, aren't there? So what kind of skin problem things have you seen come into clinic? What have you had in that you've always got a skin problem? They smell? Ear problems? Scabs, crusts, spots? Yeah, all of the above. So they all kind of look slightly different, but are one of the same. Infection kind of goes hand in hand, doesn't it, with skin problems and allergies. And it is a major cause of itchy pruritus and things like that. So it's really important that we clear these infections up to be able to treat the underlying allergies and get to the bottom of them. So again, sorry, got back pictures coming in. The main things that we see in our skin patients are either bacterial or yeast infections. You're all familiar with the smell of certain things, I am sure. We'll talk about that in a minute. And as I've said, they can present in different ways. So we might see like this ear filled with exudate, the red erythema on the top of the dog with the scaling encrusting, or we might see a cat that has traumatized itself. And these are all things that we should be checking to see if there's infection present in them. So why do they keep getting these infections? So it's a bit of a vicious cycle. Anyone with allergies themselves? Yeah? No, you've got hay fever. Or is it like a multiple, you like, just to life. So, okay, so what we basically find is pets and people that have allergies, they have got an overactive immune system. What I often hear from clients, and you might as well, is, oh, we've got the runt of the litter, his or her immune system is really weakened, so that's why he gets so many allergies. That's a bit of a myth. It's actually quite the opposite. So an animal with skin problems, immune system is actually overreacting, it's hypersensitive. So it's actually Dottie is overachieving in the, in the kind of immune system front. She can overachieve in one thing. And then what we tend to find is, so the dog has allergies or cat has allergies. These get triggered, can be seasonal, can be food, can be a number of things. And what that does, it makes the animal gritty. Itching leads to itchy, broken skin. It makes it into a nice kind of warm and moist environment. And this is a great place for bugs, microorganisms to grow, isn't it? So bacteria and yeast think, hey, this is choice. This is like quite rocky open wound here. I'm going to just kind of sit here and proliferate a little bit. And then we clear the infection up, but then the itch comes back and it all starts over again. So you can see how these allergies are quite frustrating to treat and why nobody really likes skin. Unfortunately, there is no real cure for skin disease. It's kind of a management case. That's why we're always in a job if you go into dermatology. There's some other little bins, so atopic or environmental allergies, so pets with environmental allergies, they have kind of rougher skin. They have a poor barrier function, so the integrity of the skin is weaker, which allows, again, more pathogens, more allergens to pass through. It also tends to be a bit more greasy. You've all done the pat of the skin dog and gone like, slip in it, or, oh, that was annoying. And again, so therefore they are predisposed to these infections more. Which that's great English, but well done, I'm going the wrong way, guys. This way, this way. Okay, so what is cytology? So it is the study of plant and animal cells, including their structural function and formation via microscopic examination. So it's pretty simple to do when you know what you're doing. It's that old chestnut, isn't it, of you do something a lot, you get better at it. Who's quite scared of cytology at the moment? Gary is, okay, go on. Do you know that a roll of sellotape can make you a lot of money, Gary? I don't know why I'm picking on Gary, it's because he's the only man. But it can, and it can do a lot of good in the world as well. Debbie, I quoted earlier, magnificent quote, without my microscope I can't do my job. This is very true. Debbie will not prescribe medication without taking a sample, which is great, which is good practice. One day at the Strand, where Jenna works, I think we had a microscope mishap, and she had a little meltdown. I'm not going to lie, don't read this, but it was end of the world, and she just felt like she wasn't doing a proper thorough job, and she could guess at what was going on, not make a proper diagnosis. So it's really worth doing. So why is it so good? So are we all aware of antibiotic resistance? Yeah. It is, if anyone really looked into this, don't, it's quite terrifying. I have now, and it's honestly, woo, we're all gonna die, it's a nasty skin infection. But we are at a point in our world where we have overused so many medications and drugs that we are getting common colds and viruses, infections that are not responding to treatment now as they used to, because we have overused everything so much. As I said, we cannot guess what an infection is. Smelling easily doesn't count. I can't tell you how many times clients say, he smells easy. Have you said that? Be honest. Yeah, you can, it smells easy. We get it written in notes that are sent to us, smells easy. Okay, what does that mean? What is that smell we're smelling? Just out of interest, you know. It could be heat, it could be infection, but yet generally on skin dogs it tends to be an overproduction of lipids on their skin. Because remember we said they have a poor barrier function. So what their skin is basically trying to do is mend itself, so it over kind of generates, and it's filling up these little cracks in the skin with ceramides and things like that. They overproduce, they oxidize with the air, and then they go rancid. Nice. So basically what you're smelling, that doggy kind of dead smell, is oxidized oils in the skin. So it's not used for infection, that's what you're smelling. Where am I? This dog, just for example, would you say that has infection? Just if you were to take a guess from looking at it. And raise of hand and say yes. Oh, is that no one thinks it's got infection? Yeah, thank you, yes. Yeah, who's a definite no? Him, you go to
Oh, no.
quiet. Don't pick on me. No. Okay, so this dog, it's got scabs, hasn't it? It's got crusting. It's got a bit of bleeding. So you automatically think, yes, it must have infection on its skin because it's presenting like this. Gary, would you agree?
It's a by cow and grazed on.
Yeah, that's a good call. It could be. This dog was covered in these scabs and cracks. It actually has got something called pemphigus foliaceus. Have you heard of that? So it's like an autoimmune disease. So it actually had no infection on its skin. This is, it's just like an immune-mediated disease. So then we checked it for infection. It had none. So in normal circumstances, if you hadn't checked, you'd go, shit, it's definitely got infection. We better cover it with antibiotics. But it would have been a pointless episode, and we would be adding to that antibiotic resistance that we're seeing. So always better to check. We do see that this is all my favourite, the client that you go, how's it looking? They go, perfect, really good, cleared up, great. And they're like, we've still got, 10 tablets left. Oh, so you didn't give it all the course? And they're like, oh, did we need to? No, we just gave them to you for fun, didn't we? So again, we often see that if courses of medication aren't finished or aren't completed, then the infection isn't fully treated and it will come back quicker. So we want to be moderate with our antibiotic giving or antifungals, but we want the client to take the whole course, even if they're looking better, to ensure it's not coming back. And then again, it's really important to do it so we know what we need to give. So yes, you might go, oh, this does look like it's got bacteria. Eeny, meeny, miny. No, we all have our favourite. I'm sure everyone's got Clavulux in their clinics. Yeah, we don't. I didn't know what to do. Well, why haven't we got Clavulux, Debbie? Like, what about? But is that acceptable for the type of infection? We get lots of dogs that have had infections, been given courses of antibiotics, but it's actually got fungal infection, yeast infection. So they've not cleared up. So things like that. Wrong way again. Can someone be in charge of my mouse? Please. Just looking at these pictures again, what would you say as a wild guess which ones would have infection? Anyone put some more pizza? No. Yeah. I'd hazard a guess that one was probably infected. Yeah? Yeah. Any others? What are we seeing? That's got to be a West thing, hasn't it? These are all clients of ours, by the way. All given consent, please. So again, I just want to iterate that we do not know without physically taking a sample and looking at the patient if they have something going on. And it is so important This is something I thought I'd just pop in. We get asked this a lot, or it comes up a lot. This is what's called a bacterial collarette. It often gets mistaken for ringworm. It's circular in appearance. It kind of, we resonate or say it looks a bit like a ripple in a pond, so the bacteria tends to start off in the middle of the lesion and then it kind of proliferates outwards and it causes these circular lesions. And we often get pets, and we've had a client with one as well, so I shouldn't tell you that, but that think they have ringworm. But again, taking a sample from this, looking under the microscope, it is bacteria. So just, if you see something like that, it's a very common presentation that we would see.
Will it flourish like
Sorry.
Will it flourish
No, my lovely, no, because it's bacteria. Yeah. It's a not. All familiar with this? So this is again, please get reading this, I'm sorry, it is, you just shouldn't look at something and then your brain goes wrong. We now, because we are in this era of antibiotic resistance, we now have limitations on the type of antimicrobials we can use. Ones that are the green, so good to go. Ones we should be a little bit cautious with in the orange sector, and then one in the red that we should possibly not use ever if avoided, / use very cautiously without any other needs. So that is something I would all recommend you to have a little look at and just have a look at what you've got on your shelves and see if they all fit into the categories. Why are we seeing this antibiotic resistance? I've written we're too clean. Is that a bad thing? Being too clean? Yeah. Well, when I was nice, long time ago, I was a proper farm girl. I was up to here in mud. I used to eat, cow poo, and I was a wreck. I used to have to get worms once a month just for fun. I've got a pretty good immune system. I like to think I've got a pretty good immune system. Now, especially since COVID and things, what do? We clean everything, don't we? My gosh, I've never washed my hands so many times in my life. It's actually quite terrifying how clean we've become. And I know that sounds really bad, like I'm not gross, I have showered today. But we really have become a bit obsessive with our cleaning and our use of antibiotics and things. And it's just not giving any one person, pet, anything to the immune system chance to actually, kind of fight back a bit against anything that is it. Would you walk me through that? Yeah. Wiping kids' hands with Dettol wipes. No, let them get a bit of mud in there. Yeah, it's great. As I've said, not completing antibiotic courses, getting the wrong treatment prescribed, this is all adding to it, and then also reaching a bit too readily for systemic antibiotics. So again, I think this is quite common in the doctors now. If we go in with a cold or something, they used to kind of throw antibiotics at you like sweeties, didn't they? Like your chest infection. Now they're like, oh, you sure? You're dying? No, I don't think so. But they're very reticent to give you antibiotics. That's a good thing. You could always try for skin infections, try and use topicals, which we'll discuss, rather than systemic, go straight from systemic. So, when you are examining, so this was my kind of goal, is that you guys all kind of help your vets do this. So a thorough check of the patient is always required. I think we're very guilty of looking at the blatantly obvious problem, aren't we? Like, oh, it's got its leg hanging off. That one I probably treat. But key areas to look for in skin patients are usually around the face, the lip folds, feet, top and bottom, and any kind of flexural areas, so armpits, inguinal areas and things like that, and around the genital areas and the ears. Sometimes things aren't always as they seem. I'll just quickly show you this. This was Debbie as a student, just for, I should bring that, that's terrible. So this dog had like a slight folliculitis in one area. Debbie as a vet student, I would have actually lost my mind a little bit. I would think the owners were fine. I possibly wouldn't. But yeah, so sometimes it cannot always be apparent. What we're initially looking at can go a little bit further than we're expecting. Please don't let the teacher fall dogs coat like that. It's just this line. So just make sure you're doing a thorough check of your patients. Really good things to do, my little tips are take pictures of lesions that come in and measure them. It's often a bit hard retrospectively if they come back in a week or two and you're like, how's it looking? Oh, I thought it was all right, it looks a bit better. So if you've got like something you can look back on, that's really good to do. And nurses can and should perform these exams. It's great to help your vets. It's a huge time saver. I often kind of just start initiating interaction with the animal when Debbie is talking to the client, gauge it, how it's feeling in the room, and then you can start doing some gentle handling with it. And yeah, I'm very into my low stress handling, which Ange, just if anyone wants a guru on it, this lady here, who's looking a bit sheepish, but she is amazing. She'll do some talks coming up with me because the NCP. So she's awesome. So using lots of positive reinforcement, but not forcing it on the dogs. It's very conflicting to have a treat in your face. If I came and shoved a bit of pizza in your face, you'd be like, oh, I really want to be all free and sit back. But you know my mum, so sorry. So try, what I usually do is I'll again gauge the animal. I try not to talk to them. You feel terrible, but let them come to you. Toss a treat on the floor. They don't feel threatened. They're like, oh, that's nice. She's not going to make me talk to her. Pick it up, and then the idea is that if they're not feeling too unsafe, they should come back to you and kind of start integrating on their own. So again, if you guys can be in consult with your vets doing these sort of things, it's really encouraging. I'm sure you've all got licky mats. Peanut butter is everyone's best friend, unless you've got a nut allergy, always check that first. And again, for skin patients, many of them will have food allergies, so just be aware or ask first if the owners are aware if they've got any allergies. I really like frozen broth in a cup. Does anyone do that? You do. Do you do that for inductions and stuff? It's ace. Anyone else do that? So literally just like some chicken stock or something, is that what you use? Freeze it in a little plastic, like one of your cuppies you've got, and the dog can lick it as a distraction when you're like doing cephalic being or something. A really good distraction, and it's not going to be contraindicated for vomiting and stuff. Gears and stuff. Yeah. Oh yeah, that's quite cool. And then some dogs just don't want treats or too stressed, so find something. Again, toys, praise, ignoring can be the biggest gift you can give a pet in the vet clinic, can't it? Especially me, because I talk a lot. I recommend something called a touch gradient. Basically, this means keeping contact with the pet when you're handling them at all times. So you're not just kind of sporadically touching areas of the body, you're working towards them. Especially so for areas like feet, that most pets really dislike having touched. Start in a non-threatening area that dogs or cats don't mind having touched, so around shoulders and the chest, and then gradually moving your way out to the more scary areas or the areas you want to examine. Try not to lean over them, and then I always get owners to practice at home. Derm patients are chronically awful. It sounds terrible, but they usually have a lifetime of skin vet visits, don't they? And by the time they come to see us, they're like, oh God, it's coming. So I get clients to do this at home. It's a really good thing to do. Struggling is a sign of fear. We all know this. So never get into a battle with your pets that you're treating. And consider sedation, especially for things like venous health and safety. It's very important. So yeah, that's just a little, sorry, it's gone off tangent a bit, but I just think it's important when you're taking these samples not to get into a battle with them. This is Dottie. This is Dottie's safe place on her little box. I need to come and see Ange for some handling. Just FYI, Ange does a really amazing class called Helping Pets with Vets, if you do have any pets at work that need a hand. Dottie, again, because she's got skin problems that are ongoing, she's becoming a little bit reticent about having certain things looked at. But her safe place is her public health box, and she knows that she gets good things happening on this box, so we've started doing a bit of training around that box. And then Reggie, who is a strand from the Strands team, I tried to put him on the table to take photos and he absolutely freaked. Well, he didn't freak, but he was not happy. Put him on the floor and as you can see he's not restrained and I was able to take a pretend sample from his foot. So thinking about patients' needs and where they're happiest to be examined as well is really important to do. Oh, this is always controversial. Who likes getting clients involved? Yeah, use them, I say, especially if you've got animals that are slightly nervous. We love it. We always get it. Go on, you take it. But we can give them direction on how to take samples and things. And sometimes these animals are not happier with their client, their owners, but sometimes it really backfires. So gauge again, watching body language, interaction, things with the client and their pet. You will do towel wraps and things like that. Brilliant. There's some really good websites, low stress handling websites that make it on hand, I think, and dog towel wraps and things like that. So again, just a little something for you to think about. But I'm just very passionate about not stressing these pets out when we're looking at them. So try and take some of these into account when you are taking these samples. Okay, so who has a cytology kit at work? Does it look beautiful like this? It's very nice, isn't it? No, so basically all you need, or what we use, is either a litter tray, or this was I think a $2 shop special. And basically you just need the following. So microscope slides, frosted, I would go frosted, you can write what your sample is. Your roller sellotape, pencil to write on, earbud, sorry, that should say cotton tips, I didn't know what they were called. I was like, oh. And then hemostats of different sizes, a scalpel blade, some needles and syringes, gloves, and a ruler. I thought it was quite comical that I took those beautiful pictures, but this is what my cytology kit at work normally looks like. I am human. So I was like, that's just a load of tosh. That is what it looks like. Have it centralised somewhere, either in your consult room or out in the prep room, so you can go and get it. And yeah, just make sure it's stocked up well. So, taking these samples, so the first one we'll talk about is impression smears. So, if you have a scab kind of lesion like on this cat's nose, or an open kind of moist, not with high levels of exudate, but a bit of ooze is fine. You can basically just pop a slide gently onto the area. Again, taking into account the touch gradient, the struggle rule, towel wraps. Just, it's going to be sore, isn't it, if you pop something on there, so as gently as possible as you can. And the other thing to consider is you might need to go digging a little bit under a scab, because if you pop a slide directly on top of this nose, you're not going to get any information. Where all the infection is under that scabby bit of schnob. So you want to pick the scab off slightly. Nice, told you it was glamorous. And then press your slide down very gently on there. Sometimes you need to pop a spot or two. I love it. I really miss a cat abscess. That's what I miss from general clinic. If anyone has one and wants to call me, I'll pop in. Just they're really great.
Literally.
Yeah, literally. So yeah, again, you can just take a small 25 gauge needle, just make a slight piercing. You know it when you do. No one squeezes their own spots, I'm sure. Just to make a little sterile opening, squeeze the exudate out, and then again place that slide on top of it to gather the information. You can break a slide through this, just FYI, I have done it. They are glass, so just be kind of gentle. I know, I surprised myself, but it's my strong hand. So that is your slide impressions. Then this is where your roller sellotape comes in handy. So anything that's superficial and hasn't got lots of ooze or exudate. So usually it's kind of feet, foldy bits around the genital areas and things like that. And any kind of crusting as well, you can pop just a bit of sellotape on. again, just be aware feet are a very tender, kind of sensitive area for many animals. So thinking about how we're going to get the sample. Sometimes it's just not possible because they are too sensitive. So you might have to again get the owner to take it, use muzzles for safety and things like that. But generally where the infection is found on feet is in between the toes. So again, thinking that can be a little bit tricky to get sometimes. You might need to cut hairs or mats away from the toes if they've been looking at them. But making sure you actually get your tape well in between the toes, not just on top. Again, that's where you're going to be finding any of those microorganisms. Nail bed infections are very common as well, but can be very sensitive. So just gently pressing around a nail bed is good to do. Some dermatologists use toothpick, but I think that's quite sensitive. We don't do it personally, but I do know some do. So take care when using a toothpick on feet. Again, this was my old dog. He was a lot calmer than Dottie. You could do anything with Eddie. This is why I'm so shocked with how easy it is. It's like a sand model, and then for the face, so this is a very common area where you see infection. Anyone smell a cocker spaniel's mouth? It's got like a lip fold of pyoderma or something, delicious. Clipping the hair away can be useful, but again, a bit of a sensitive area to clip. And then just remembering that there are lots of folds, especially on French bulldogs, and we tend to see every French bulldog in Auckland, I'm pretty sure. Sorry if anyone has one. But they do get a lot of facial kind of infections around their little like vulval areas and things as well. So just make sure you're going in between the skin folds to get your samples there. I know this sounds very basic, but gloves are really great to use when taking cytology samples, but you really stick to sellotape with a pair of gloves on. So just if you wear gloves prepared for a fight with your sample, wash your hands after if you don't wear them. And then just again, a very silly, sounds silly, but a sensible thing to do is to stick with one end of your sellotape on your area or something, and then just stick one side down to the slot because we're going to want to stain this. Okay, so that's that. Ears. We see so many ear dogs, it goes hand in hand, skin and ear disease. And again, most dogs hate, well, lots of dogs hate their ears being touched, don't they? Or they are frightened of having their ears touched. They're sore, they've had repeated ear infections. So just go slowly. I've said it already, but sedation is often kinder if you've got bad ear infections and things. And definitely think about it. Oh, hello. You can tell I took some of these during COVID. Oh, we miss having a mask on. So again, little espresso. She shuts her eyes when you look at her. So beautiful. And then you put her on the floor and she's like a little pocket rocket of a mug. Using, where she's most comfortable or the patient is most comfortable. I use really minimal restraint where I can. I'm basically, she sat now, this thing is like a little ping pong ball normally, but she responds greatly if you don't get in that kind of wrestle with her. I'm basically, Debbie's going in this ear and I'm just gently manipulating, I suppose, or gently, what was the word, moving, I suppose, her other ear. It's kind of like a distraction, and I find, minimal kind of restraint, just doing that often works really well. Angie, have you got any other little tidbits on that? You'll probably have a whole lecture on that, but...
Yeah, I guess as long as they get quite sensitive to the tapping feeling, that's can be quite aversive for little dogs. So the more gently you're holding them, the more likely they are just to sit there and just be part of it. So I often find that they'll just start fighting against it as soon as you try restraining.
Exactly. Yeah, that's cool. Anyone do that tapping thing? I think I'll be so irritated. Pack it in there. And again, that's where your frozen broth, your peanut butter. I love smearing the dog's face with peanut butter. It can be really good and distracting, things like that. And then it sounds really silly, but get to know your ear anatomy, especially if we're going to be directing owners to be taking samples, because there's a lot of creases and crevices in the dog's ear, isn't there, and cat's ear, and they're often like, where are we going? So if you are going to ask the owner to take it, just make sure that they are actually going into the kind of canal rather than just the external ear. This lady is wonderful. He's a rather large Kerry Blue Terrier. Has anyone seen them? They're like giants, just saying. He's very protective of his mum. He's a lovely dog, but he won't let us do anything, but she can do anything to him. So again, we've directed this lady how to do it. The idea is to pull the ear up. If you pull an ear back, you're squashing the canal. So pull an ear up and kind of out, and then you can get your swab into the ear, take your sample, and smear it on the slide. Oh yeah, here you can use a gauze swab, a sterile gauze swab. Again, this is great for clients if you're getting them to take it and the dog doesn't like the cotton tip. They can just pop it on their finger and try and go in a little bit. It's quite good to do. When you're putting your samples on a slide, you can just use one slide. I usually have the frosted with the writing on the left side, and then put the left ear on the left and the right ear on the right. So you're just saving money on the slides there, Gary, top tip. Anyone ever dropped a box of slides? They've broken to a million pieces. Yeah, so that's just, and you kind of want to roll it out. I kind of do like a side to side, and so you're making that little one. And then skin scrapes, I'll just go quickly because luckily we don't tend to see a lot of mange anymore. Anyone seen a sarcoptic mange? Now that one smells, that one you can say smells, I'll give you that. Demodex? Yeah, we see a bit of Demodex, but because we've got these awesome flea treatments now with a little, oh gosh, it treats this as well, we don't often tend to see a lot of mange, which is great. But still good to know how to do it. So usually they would have a lesion, or many lesions, depending on where it is. And often if it's Demodex, it will be on the face of the feet, so you have to be a little bit careful when taking these samples. Oh, hello. There we go. So what you want to do is squeeze the affected area, and the thought being that if there are mites in there, they'll go really up to the surface a little bit. With your size 10 scalpel blade, you pop a bit of paraffin oil on the blade and on the skin, and then you want to kind of pull the skin taut and do like a firm scraping motion in one way. Don't kind of butter your bread, just go one way, and we're looking to get kind of a particulate, kind of like a little bleed. And then you basically take what you've got on your scalpel and smush it onto your slide with your paraffin oil. Have you all done that? I don't know. Again, you might not need to just because it's not that much around. And then tripicograms is just a fancy schmancy word for a hair pluck. Basically, I tripigram my eyebrows like once a year. So yeah. It's a really good thing to do for especially cats. You all have these clients going, does it groom himself? And the cat's like naked from the it's like, no, that must have just fallen off, yes. But it's a really good way to look at how hair is growing. So basically, hair, it has different stages of life. It goes into like a resting period, an active growth period. Just by doing something as simple as plucking out a bit of hair, you can see if it's growing. So if it's been broken from grooming, so the ones that haven't been grooming, you can be like, yes, see. And it's just, again, a really good indication of what's happening. You would literally, as it says on the tin, pluck a bit of hair out and pop some paraffin on the slide, and then pop the hairs in the same direction with the bulbs at one end and the tips at the other end onto a slide. And it's really easy to do. But again, like us, when we pluck our eyebrows, you do one or two at a time. Don't go for half a dozen eyebrows. I'm not that pushy, but you know, it would hurt. So just go nice and gently. You can do that squeeze again if we're thinking of Demodex down hair shafts. And just, yeah, don't pull it back so you have a time. Here you go. Oops. Although that does look like we have wound out a massive bit there, doesn't it? That'll do. We need it for a picture. Cool, so that's kind time before your sample taking, and I always say that more is better when you can. If you're not quite sure if you've got something, just go back for another one, just in case. Again, as long as the animal will allow it. We then want to stain it. Do you all do the staining? Or have done? Yeah. Anyone spilt purple stain before? It goes a really long way. So again, we just have a little tray with an incontinence sheet, and we just use these little urinary bottles to hold the stains. Does anyone have proper coupling? Like, oh, you have posture. Damn. Oh, do you? Okay. We should really, we're specialists, aren't we? But we change ours so often. It's actually very wasteful and not very good for the environment. But it's
How often do you change it?
weekly.
Weekly?
Yeah, but if you think we probably do in excess of if we're fully booked, like 100 samples. So, yeah.
Yeah.
So, and they do get manky, I can't think of another word. Manky. Yeah, so it is good, especially some people like to have an ear cytology.
Yes.
Yeah, because they tend to leave little movies in, that's quite nice to do, and a skin one. But again, just because we see so many, we replenish it more often. You should wear gloves for this. We're not in the pictures, I don't think, so apologies. But yeah, it does, you get some nice light nail varnish kind of look on your fingers otherwise. And yeah, we just would always check if they do get contaminated badly, then you can change them. Top tip as well, leave the lid on the fixer because it evaporates, and sometimes you go back after a day and it's like, where's it? Not back. There's lots of different techniques for this. There's no right or wrong as long as the slide is in the stain for a semi-long period of time. So what do you guys do at work as a rule?
12.
Oh, you're at 12, did you? 12. I like that because, sorry. Any variants on 12? Have you guys done that? Oh, remember? You're like, was I in that picture?
I think we did a 5-6.
Okay, 5-7. Yeah, so that's cool. So there's a dippy technique, a number of dips. Yeah, that's right. And then there's the second duration. So again, there's no right or wrong way, as long as you dunk it in, agitate it. So I would do in, agitate, out, and I do repeat that 5 times. You don't need to rinse in between, you just go from one to the fixer to the red stain to the blue stain. And we only use these diff quick stains for skin. We don't have any other fancy stuff. Do you use anything different? No. That's all we need. Some people will heat treat samples with a hairdryer. Don't really need to. That's if you have high amounts of exudate on the slide. It's all that if you heat treat it, it will make it stick to the slide better. We personally don't do that, but it is just thin ones. And then you can either be really proper and use distilled water, actually a little nice bottle, or you can be like us and whamming it through the tap. Basically, yeah, just as long as it's a slow trickle, just to wash the excess stain off, that's fine. I usually then blot the slide with a tissue on the back and then stand it to dry, waft it about a bit. Yeah. Does that sound pretty familiar? Yeah. And then just for your sellotape that you've got off your gloves and stuck on the thing, the left one end open, don't put it in the fixer. What happens if you put sellotape in the fixer? It does. I've got nothing left. Yeah. So basically we just use the purple stain or the blue stain, but you can do a drop of the red, stick it down, wipe off the excess, pull it back up, drop of the blue, wipe off the excess, but Debbie tends to find that the blue stain will pick everything up and be sufficient.
Sorry, can I?
Yes,
You go back to that.
yes, honey. Oh, sorry.
Photo bomb.
It's all right, my neck. And then microscopes are much of a muchness. Who does their microscopy at work? Who can use both eyes to use a microscope? Not me, man. Like, I'm a one-eyed microscope user. Is that pretty common practice? Why is that? After years of work. So just become familiar with your equipment. I know that sounds really silly, but they are slightly different, and you don't want to be that person that when you're looking, you smash the slide because, oh crap, I over twisted it. So just become familiar. Usually what I do when I get a slide is I look, like it's nothing mind-blowing, I look for the area that has got the most amount of stain taper, and I put that area right under the, under the lens, thinking, gosh, that would be good, wouldn't it? Usually works. Start off on your lowest lens, focus, and then work your way up. And what are we looking for? We're looking for the bacteria and yeast, Malassezia, that we discussed. And then you also get a lot of other things thrown in for fun when you're looking at cytology, just to throw you off the mark a little bit. So usually a lot of blood cells come in, and then you get skin cells and things like that. And then the odd random things, so like an campyloric cell, and say that chemicals. Really good resources that you can get. Do you all have these guys? Do you have one, honey? You do, don't you? You have a little cookie. So, come on.
Cytology.
Yeah. GLA, I'm sorry, mate. Yeah, they actually have a really. Do you have any?
I might have
Woo! Honestly, they're really good. Actually, I'm so sorry, I forgot that. Yeah, but that'd be a really good resource, and then you can get little other ones to pop up in your next to your microscope. So common things that we see. What is this one? Does anybody know? So I usually go for shape and colour. So this is Malassezia, so this is yeast. So they're quite different to anything else that you would view. So they're often called snowmen, or they look like little footprints. They're quite cute, aren't they? Just bear in mind that you do have some of these on your skin. You have quite a few gross things on your skin, guys, don't overthink it. But when you've got kind of more or quite a few is when you're looking at a problem. So that one is Malassezia. Oh, sorry, went a bit far. This one? This is Staphylococcus. So it's little round balls, basically, not very technical. They can come in clusters or in chains. And this is one of the most common ones that you guys will see in the neck. Then we have these guys, which are rods. Have you heard of rod bacteria, like Pseudomonas kind of ones? So these are really common in ear infections, like really nasty ear infections. Really hard to treat. They've got like a little slime capsule around them, so using something like Otaflesh is really good to break down that slimy capsule, and then you can treat them, penetrate them with an antibiotic.
What kind of medications do you see?
Yeah, good. So again, you always start on the lowest, and these would be under your high magnification with your oil on. And then these guys, again, they're just kind of like your hairy ones that are thrown in for fun. So when you have skin disease, you always have inflammation, so therefore you generally would get other blood cells coming to the party, so saying things like lymphocytes, macrophages. This is probably all taking you back to your school days, isn't it? But again, just becoming familiarised with these different things under the microscope, just so you don't go, what the heck is that massive nucleus? Oh, it's a lymphocyte. Why is that? Oh, because there's chronic infection. And then the other common ones that we see are neutrophils and eosinophils, especially eosinophils and things like allergic skin disease with parasites. So you've all heard of those sort of things. So, as I've said, we want to be really careful with our antibiotics and systemic treatments that we use. And we need to start being more responsible and looking at using topical treatments where we can. To prevent having unnecessary medications, and then also just, to help. No. So have you guys all seen these? Have you anyone stopped these now? They're quite cool. Another really good one, which I'll talk to you about in a minute, is this very new product, not just because it's GLA Pharma, but it's awesome. We did a little trial in the build-up to getting this into the country, so it's like literally in now, hot off the press, and it's a really good topical leave-in conditioner, antibiotic and antifungal conditioner, which is grand. So if you can treat an infection with topicals, it's brilliant. I'll show you again Dottie shortly, who had a bit of a flare-up recently. Doing things or recommending things to your clients of bathing, something as simple as bathing once a week for a patient with skin disease can hugely reduce microorganisms on their skin, saving flare-ups and things like that. Just simple wiping down of a, do you recommend things like this? Yeah, just literally damp cloth, flannel, wipe the pet when it's been outside. It will reduce any allergies on the skin.
So how do you balance that against taking the oils off and breaking the skin barrier down?
So that's a good question. So you're not gonna. So if you use a proper quality shampoo and or conditioner, you're not going to be destroying any oils on the skin. You're actually moisturising and helping them. Plain water you would use just to wipe them down. So again, not doing anything detrimental. And then you can do things for skin barrier function. So these will actually help a bit. And then you can give things like safflower oil, which is an omega-6, which really helps your integrity of the skin, things like that. But yeah, honestly, bathing once a week, once a fortnight, you need to give oils to a great extent. Especially if you use a good one. If you use something like Head and Shoulders, which lots of our clients like to use, I'm just saying, that's probably not great. And then again, we have got really cool things. Sorry, they're not GLA Pharma. But these mousse, we find the mousse over the conditioner really good. Have you used them? Not a chemist, but you literally, it's just like a spray, leave it, conditioner or mousse. And then other things that you can recommend, and I do for Dottie, I have a neoprene collar. So it's water resistant. Taking the collar off, heavy, thick set coats, because especially things like golden retrievers get some infections in their neck and stuff like that. It's really good to do. And drying them properly off without too much heat. And then I've written bleach at the bottom. Don't think I've gone absolutely stir crazy, but this is what it says on the tin, actual household bleach. So not your lemon scented, whatever, but Genola 5%, but to a very diluted concentration. So I'm talking, I can't tell you off the top of my head, it's like 5 mils into 5 litres or something like that dilute. So like we're talking swimming pool water. We found, well, there have been studies that show spraying this diluted bleach dilution. I can send you about the proper, please don't spray again, for maintenance, if you spray it onto atopic or allergic pets, it can just help keep microorganism numbers down, and it's not dangerous. But honestly, so many clients are like, what? We're not dunking them in bleach. But again, I'm talking like dilute. So yeah, oh, she was so cute. So yeah, just literally wiping. So Dottie gets a wipe off, much to her disdain. A hose at the minute is bogging out there, isn't it? Every day. Eddie used to have his feet dunked off, things like that. So yeah, this was Dottie's tummy the other day. You can't really see it, it looked horrendous. You see all my spots and pustules. I lost all track of my brain having done this for ages. Like, oh, Debbie, what's happened to Dottie? She just had a flare-up, calm yourself. Come now. She did have some bacteria in there, some staphylococcus, and surprisingly, quite a few pustules. But she's not quite here tomorrow, just saying. We don't really want to give her systemic antibiotics because she's so young, and there's a full process that you can give them antibiotics too young. You can have flora out. And I'm not just saying this. She seems like a bit of a we did, because we may have had some sample bottles from these guys. I literally just slathered her stomach in the Pionex conditioner, and within 2 days it cleared up. And so you can see that she has full-on spots and pustules there. and I would have normally in normal circumstances, I've never had to go to it, she needs them, but we just topically treated it and that infection resolved. So that's quite cool. And again, I'm not just saying that this is one of our favourite products, I'm really excited to have it. Other things that can be done, so for ear maintenance, we're not a big fan of ear cleaning as such at Swing Vet. That's just again our personal choice. We tend to find it can leave ears quite macerated and wet. So we would prefer to use something like Otaflesh on a cotton pad just to clean the external ear as much as you can. And then my rule of thumb is as far as your finger will go into an ear is safe for cleaning. And then these impregnated wipes and stuff are really good to use. And then we used to have a really cool old school product called Alpha Ear Cleaner. You heard of that? It's discontinued now annoyingly, but it's like a swimmer's ear. So it helps to dry ears out again. So the environment is great for growing things. So really good to do. And then keeping ear hair short. There's a whole lecture on plucking ears, pros and cons. It can be helpful in times to pluck ears so you don't get so much infection, but it hurts. So I think that's it. And then Dottie again, such a tart. This is the awesome competition that these guys are running that I used to talk about earlier. So if anyone's keen to enter, you can scan the QR code and be into delicious lunch. I'll put it back up in a minute. Can you tell I love my dog? Yeah. Any questions on? Sorry, that was a big overhaul of everything. Just one question. Go on. Give me a question. He's like, no. Give me. Oh no, you did ask a question. You're right. Okay.
Why not use gram stain instead of typical?
Because we don't really find that we deal with bacteria that needs it. We tend to pick up everything with just the general Diffbrook stain that we use. Any hairy stuff or things that are non-resolving, we would send off for a potential culture at the lab. But again, Debbie does all our cytology mostly in clinic. So there's no real need for extra stainages. We tend to get all the information.
After you've done a skin spray, yes, and obviously leaving a part of the skin that is
Yeah.
quite tender, do you guys have something that you pop over?
Yeah, you can use something like Isoderm if you've got that in clinic. It's like Neosis. Yeah, something like that. Or Cristoderm is a really good. That's my little friend on my chin had some Cristoderm treatment last night. That's a really good one that you can just pick up from the chemist and they can buy over the counter. It's just not antibacterial. But yeah, so it just kind of covers them and stop them. Yes.
Wiping, are you wiping cloth with something on
For the general wiping that we were talking, no, just water. Yeah, just plain water. So we often say to clients, just leave a flannel by the door, so that, because it's so hard to remember to do stuff and then, oh crap, I haven't done that. So, or leave it by the lead so that you put it out by the door, so when you come back and you're like, oh, cloth bowl, white dog. And honestly, that saves a world of flare-ups. Yeah, just something as simple as that.
So you're reducing the allergens on the dog?
Yeah, so especially running through long grass, especially now when it's so filthy as well and everything's wet. And
hose would be more effective?
would be great, but it's harder to do, I think. Or it might not be, but lots of dogs doesn't like the hose, so I just cloth her. But hose is fine.
So even if they haven't been going through teeth or other things like the grasses?
Yeah, they don't physically have to be. So if you've got atopy or environmental allergens, you can be